Again, welcome everybody to our workshop, Envisioning One Health for the Future, Aligning Human, Animal, and Planetary Health. My name is Moritz Fegert. I'm a project manager at Foraus, and I have the pleasure to guide you through the evening tonight. Before we dive into the workshop, maybe a quick word about Foraus. Who are we? We are an independent think tank supporting decision makers and the general public in opinion formation and decision making. We organize innovative workshop formats such as the one we're having tonight, and publish scientifically based constructive recommendations for action in 12 different thematic fields, amongst which one is global health. We are a volunteer-driven platform and international network which gives a voice to youth around pressing transnational policy challenges. And tonight, it's not only me, there's Eduardo Bellinchon, who's going to do the tech and also facilitate one of the breakout groups later on. He's also working at the Foraus office with me. And there's Letizia Thierren and Simone Graven from the Global Health Group, the thematic Global Health Group, which they're co-leading, which will also help in facilitating today's breakout groups. So why did we choose to decide to work on this important topic of One Health at Foraus? Well, you can see it on the slide. The context is not super rosy. There's many challenges ahead. We have a really challenging future ahead with the growth of human and animal populations, habitat destruction in many areas on the globe, industrial livestock and agricultural production exploding, and the major issue of climate change. And while there's all these challenges, there's also, there has been quite some thinking about how could we approach these different challenges. And One Health is actually a way of trying to address these in a holistic way, thinking human, animal, and ecosystem health in more holistically, and trying to work on the interlinkages and find multi-sectoral solutions to these problems. So here's just a really short definition, a working definition that was developed by the One Health high-level expert panel. But our speaker, Cheryl Stroud, will really be able to give us a more in-depth definition and insights on One Health, on the One Health approach, where it comes from and what it actually means and why it matters. And you will also see here that because at Foraus we always look into how do we find multilateral solutions which are cross-border and transnational. At the multilateral level, One Health is essentially introduced at the moment via soft norms or non-binding commitments, or multi-sectoral coordination mechanisms such as the One Health high-level expert panel, which was created in 2020 between the World Health Organization, the World Organization for Animal Health, the UN Environmental Program, and the Food and Agricultural Organization. A quick word about our project, One Health for the Future. We said, okay, we have these efforts on at the multilateral level. We have these soft norms which are being developed, but what we actually also need is a participatory process where we ask experts, practitioners, but also the general population and interested people about their opinion and maybe solutions they can see with regards to One Health. So this project is a participatory process exploring the concept of One Health. We are focusing on 3 major challenges that One Health is trying to address, and in the end also trying to prevent from happening. So it's zoonosis, antimicrobial resistance, and last but not least, food safety and security threats. And the end goal of this project is to generate recommendations for action about the necessary policy steps that should be taken at national and international levels to support the prevention of these phenomena from occurring with a One Health approach. This project would not be have been possible without the kind support of the Rosa Luxemburg Stiftung Geneva office. So we're really grateful for their support. A quick word about the project process. We have our workshop today where we will define dystopian scenarios, future scenarios around these three phenomena I just mentioned. And then these scenarios will actually be tested by practitioners and experts at the Geneva Health Forum on the 5th of May. But the project doesn't end there. We will, with these the data and the results of these two workshops, we will make a short summary, a policy brief about with these, and share the ideas from the process at the Berlin Falling Walls Science Summit in November, where the results will be presented to stakeholders in the field of public health in Berlin. A quick word also about tonight's workshop. We have a first part where we will hear more from our two experts about the concept of One Health and the concept of collapsology of health systems. And then in the second part, we will dive into really go into a more practical modus and work in smaller breakout groups, defining main issues related to these three phenomena, and also working on scenarios we envision for 2050. At the very end, we will wrap up the workshop with a little pitching session. You will share your scenario that you developed in your respective smaller groups with the rest of the group. And before I give the floor to Cheryl Spratt for her input, I actually quickly wanted to ask a bit with I would have some questions for you to see with whom we are in the room. So the little game we're going to play now is just I'm going to ask you a question, and if the answer is yes, you can switch on your camera, and if the answer is no, you switch it off. So my first question is, who is joining us from Switzerland? Yes. You see, we have almost half of the room who's from Switzerland. Who's joining us from Europe? Some more people. Who's joining us from North or Latin America? Okay. Yeah. Yes, Ada. One more. Yeah. Two people. Yeah. Perfect. And from Africa? Yes, another person. Finally, Asia, maybe, but it's pretty late, so maybe not. But yeah. Second question is, who's doing research or practicing in the field of One Health? Yeah, there's quite some people. Great. Who is completely new to the topic and wants to learn more about One Health tonight? Okay, so just a few ones, but we have quite some people who have already a background in One Health. And finally, who believes that we need to change the way we address phenomena such as zoonosis, AMR, food safety and security threats in the future? Who believes that there should be a change in the way we address these? Yeah, but that's perfect. That's why we're here tonight to think about innovative policy solutions. So yeah, thanks a lot for participating in this little game. It's always nice to see with whom we are in the room. And of course, then when we dive into the workshop and really in the breakout groups, we will also be able to exchange further about different backgrounds why we're here tonight, and of course exchange on our ideas we have for future solutions. Yes, with this, I would give now the floor to Cheryl Spratt. Cheryl, before I give you the floor, I just quickly want to introduce you. You are the Executive Director of the One Health Commission. You're also an adjunct assistant professor at the Department of Clinical Sciences at the North Carolina State University College of Veterinary Medicine. You have professional experience in industry, academic research, teaching, private veterinary practice, and of course, One Health. And since 2013, you're the executive director of the One Health Commission, with whom you are trying to build bridges between communities, between sectors, advocating for One Health practices and also policy measures, and really connecting the global One Health community. And it's really great. If you didn't yet check out the website of the One Health Commission, I really advise you to do so. It's a library on One Health with many information, where you can find all information about the different actors active globally. So yeah, with this, I give you the floor now, Cheryl. You wanted to share your screen, so I'm gonna stop sharing mine. And yeah, thank you so much for joining us today.
Thank you, Maurice. So I've just requested to share the screen. And tell me when you've got my slides in full slide mode. Great, thank you very much. I'm really excited that you guys are having this conversation. Thank you for bringing One Health forward for this discussion and for this project that you're leading. And thank you for asking me to share my passion and insights about this, since I've kind of been eating, sleeping, and breathing One Health now for over 10 years. I bring you greetings from the One Health Commission, a nonprofit based in the United States and North Carolina, but working globally and internationally to try to connect One Health stakeholders and players and participants around the world to create teams and networks that work together to educate about One Health. I'm actually going to try to turn my screen off, my camera off, although I'm not seeing how to do that right now. Guess you're going to have to just watch the little talking head while I talk. And while we're doing that, we try to nurture the next generation of One Health leaders. So thank you for what foraus is doing in that front. And thank you for allowing me to speak. I always try to say a real quick thank you to all the organizations around the world that have supported the commission and continue to support the commission, because without their help, we couldn't do anything. And I'm sure foraus understands that too. So in the next few minutes, I would like to just really briefly try to answer this question about what is One Health, and really help remind us all about the full scope of One Health. And I know that we're focusing today on 3 subsections or subtopics of One Health, which is zoonosis, AMR, and food safety, and really try to help us understand just how those topics are connected to the health and wellness of animals and ecosystems in the environment. And really, we'll touch on some of the how we're on an unsustainable path currently from some of these. The take-home message that I hope you get from my comments is that no one profession has all the answers. No one profession knows everything. So we have to find ways to collaborate. And in our current systems of silos, where we don't ever really have opportunities to communicate, especially our publication systems, that is just not magically going to happen. We must create opportunities to find each other, individuals working across professions, and individuals working in different professions on similar topics and finding ways to join hands. So, we as humans have this tendency to have an attitude that planet Earth is the most important planet in the universe, and we're the top most important species, forgetting that we are just part of an ecological continuum. We're just animals, and we have to be able to support all the ecosystems that keep all the animals and ourselves healthy. So I hope that that's kind of an underlying thing that you get, because as humans, we do have a tendency to use the environment and extract from the environment things that we need and we want, without necessarily paying attention to the larger picture of what exactly we're doing to the environment. So, we have some huge responsibilities as that species that seems to have the most devastating consequences on the planet. And it's not the planet that we're worried about, it's humanity and the animals. The planet will probably survive, but the way that we're managing the environment, we may not. So we have some really big topics to address. On the definition of One Health, there are so many definitions of One Health out there. Basically, it's a concept and an approach that really recognizes and tries to bring us together in this space, recognizing that people and animals in the environment, ecosystems, and plants are all inextricably interconnected. And this is just a handful of logos from around the world of organizations and groups that are working in that space, trying to help us not just talk about it, because historically we've talked about this as academicians for 15 or 20 years. We really need to move it to action now, which is why I'm kind of excited about this workshop, because you're actually talking about One Health and how it can be implemented, or how it must be implemented. Otherwise, what is life going to look like if we don't do this? And I often speak of One Health as our ray of hope for the future, because we are currently, if we stay in our current systems and our current silos and don't address some of our most wicked problems together, then we really are doomed. And thank you, Moritz, for mentioning the One Health high-level expert panel and their definition. I think it's a little long, but it's exciting to me that we have the kind of recognition that we have from the United Nations and WHO and FAO, and now just in the past couple of weeks, really formally incorporating the United Nations Environmental Program, the UNEP, into that group, formerly known as the One Health Tripartite, now being known as the One Health Quadripartite. So that's a new word we have to learn how to say. So as you know, this is not a new concept. This is an ancient concept that many indigenous societies have in their DNA. They think this way for centuries. But it is for us today in our current silos and our current systems, a new professional imperative. And yes, it was zoonotic diseases that first got our attention and pointed it out to us that we really need to join hands across professions. Many people still don't realize that HIV/AIDS started out as a zoonotic disease. And the One Health conversation really, it probably started in the late 90s, coming out of the conservation medicine sectors and ecology sectors. And we're talking about, oh my, look at all these diseases that people get from animals. And then in the early 2000s, the veterinary world picked it up and started making a lot of noise about it. And now the whole world is beginning, especially with COVID, the whole world is beginning to understand. So we've experienced starting, early in the 2000s, that avian influenza and then in 2003 or so, the first coronavirus, it kind of scared us, the SARS coronavirus 1. And then, of course, we've dealt with Nipah virus and Zika and Ebola. And, the world is starting to understand exactly how important this zoonotic disease conversation is for bringing people together across sectors. And it is a tremendously important part of the One Health conversation. There are so many challenges today. This is an example. We'll never eliminate human tuberculosis in India without controlling bovine tuberculosis. So it is of major importance in the conversation today. But what we have realized over the past 15 or 20 years is that there are so many arenas and so many challenges that are begging for this One Health approach beyond zoonotic diseases. And this is where people start getting confused, because one minute we're saying One Health, and then the next minute we're talking about climate change or animals as sentinels or antimicrobial resistance or non-communicable diseases or vector-borne diseases. And so what I try to do is help people understand that this One Health conversation is needed in so many arenas that we don't get confused. Just know that what we're saying is we've got to join hands across professions as we address all these issues. So on animals as sentinels front, I'm just kind of really skim the surface on some of these, because I'm not even going to get to really skip a stone off the water here, because there are so many topics that we could talk about for hours. But on the animals as sentinels front, this can be really critical on the zoonotic diseases front or the vector-borne diseases front. And a real quick example is, many of you may be aware that back in the 80s, around the world, but especially in the United States, we started introducing polybrominated diphenyl ethers, PBDEs, as flame retardants into upholsteries and sofas and carpets and even the hard plastics of computers. And someone very alert and observant noticed that about that time, we started observing hyperthyroidism in cats. Now, I came out of that school in 81, so I'm going to age myself a little here. But when I was in vet school, we were not discussing hyperthyroid cats, but it turns out polybromide diphenyl ethers are tremendous endocrine disruptors, and they were in our environment. And the cats were actually a sentinel for what we as humans were being exposed to. We were putting these PBDEs in children's pajamas for flame retardant issues. We really were trying to help, not realizing that they were such powerful endocrine disruptors. So now that we know that they are powerful endocrine disruptors, and we are also seeing them in infants, we've stopped putting them in infants' pajamas and stopped putting them so much in all the surfaces, but they're still in our environment from when they were used. A similar story came forward with perfluoroalkyl substances, which we're now finding so widely distributed in the environment in the US. I would love to know what it's like in Europe. But the bottom line here is that the cats were serving as sentinels for what we were being exposed to in our environment. And this serves not just for contaminants, but also for zoonotic diseases. So just one real quick point. And then, of course, antimicrobial resistance is the quintessential One Health issue. The story about how we started using antibiotics in animals for growth promotion and for keeping animals healthy. This is really nicely presented in this little book that my colleague Laura Kahn wrote. And one of the take-home messages from that book, it's not just the interesting story, and I know many places around the world we've stopped using antibiotics as growth promotants and for the animal industry, which is a good thing. But the thing that really was a kind of a take-home message out of this book is that the antimicrobial resistant pathogens and the residues of antibiotics in our environment are affecting the microbiomes. And we share our environment with the animals, especially with our companion animals. Some of them, at least in the US, I don't know about Europe, but people are sleeping with their cats and dogs, and we share those microbiomes with the animals in our environment. And we weren't really paying attention to antimicrobial resistant pathogens in companion animals. I understand that there is a group in Europe that is actually monitoring antimicrobial resistant pathogens in all species, including companion animals. But we really had to start really paying closer attention to that. We're now seeing antimicrobial resistant pathogens and organisms in marine mammals in the middle of the ocean who have never been given antibiotics. But there's so many of these microorganisms now that are exchanging their genetic materials in these open environments that we really have to start paying attention now as to what's going on with the microbiome and how we're getting so many of these antimicrobial resistant pathogens in our environment. For example, I didn't realize until a few years ago that the intensive fish farming systems actually use a lot of antibiotics because they've crowded a lot of fish together in these pens, and to keep them healthy, they pour antibiotics in, and then there turns out to be huge amounts of antibiotics getting into the waterways and in the residues under those pens and soil residues or the sandy bottom of the ocean residues. And now microplastics that have become such a problem globally in our oceans, it turns out we're finding out that all those little tiny microplastic particles are hubs for pathogens and antibiotic resistant bacteria. And I would have thought that these kinds of things would be following on to the antibiotics and the antimicrobial resistant pathogens in our environment. So there's no way we're going to deal with all this unless we work together with the engineers and the chemists and the social scientists trying to help us stop putting so much, using so many plastics and getting them into the environment. And I'm really kind of horrified now in this pandemic. At least in the US, there are so many people under shutdown. We're doing takeout food from restaurants, and so much plastic and styrofoam has been used through this pandemic. I hate to think, how that's being managed and where it's going now that it's going into our landfills and getting into our waterways. These are the kinds of things that we have to address, or we really are going to face some really bad future issues. And also, even in our crops, plants are a huge part of the conversation here, and they need to be pulled out and talked about separately and not just lumped into the environment. So I just learned a few years ago that we're literally using streptomycin and oxytetracycline in plants, especially citrus crops. And I'm sure there's a need, and I'm not saying we shouldn't do that, but I'm just saying, have we really evaluated what effect that's having on the environment, how long they stay in the environment, and what effect it's having on the soil microbiome? We're beginning to realize now that the microbiome of the soil is almost as important as the microbiome in our guts. It has everything to do with the way plants are able to absorb nutrients, with just the milieu of the bacterial microbiome of the soil. So, who would have thought that we who are going into health fields would really need to be aware of and cognizant of something like the microbiome of the soil and the health of the soil. There's even a book about this on soils and human health. So, really watch that space and help us bring that conversation around, especially on the antimicrobial resistance front. Another thing that kind of concerns me is I became aware a few years ago that on the antimicrobial resistance testing front, we really do not have standardized testing procedures around the globe. So we're possibly, when we're trying to compare the number of antimicrobial resistant organisms from country to country, we might be comparing apples to oranges because our microbiology growth mediums and augurs and protocols are not standardized around the world. There are a couple of organizations that's trying to make that, just standardize that. But I think it's just another issue that we really need to be paying attention to and trying to help facilitate, because this is one of the ways we monitor what's going on. I'm just going to mention briefly disaster preparedness and relief, because I think this is a huge issue, not just for our food safety and security, because how many times are we going to have these scenarios where we've got a natural disaster, a hurricane or a flood of some sort, and nothing was planned or prepared for what was going to happen to the animals? Maybe we need to not be putting intensive agriculture facilities in places that could flood, or at least have plans in place when something like that is coming. But just think of the public health hazards that happen in these situations. And that's when we start talking about the zoonotic diseases. So, so many of the things that I end up talking about are really almost the interconnections of the interconnections that we've got to be talking about and putting plans in place for. On the food and water safety and security, I just think that we're going to have to come up with some new systems. I think we can't keep clearing land to graze more cattle and raise more crops. I think we're going to have to come up with some vertical farming systems, or really pay attention to aquaculture and how we're going to raise our food. We see more and more people having backyard chicken flocks, which is wonderful. I love that fact that they can have backyard chicken flocks. But we've got to make sure that the public is educated about some of the pathogens and some of the risk of having those chickens, and not letting the children kiss the chicks because some of them are carrying a salmonella or campylobacter. It's the same thing on a lot of our companion animals. We really need the public not to be afraid to interact with the animals. Animals are so wonderful for our health. Our pets are so good for us, but we need to know the risk and develop habits that keep us safe, so that we can interact safely, not just with companion animals, but with wildlife. I'm thinking about bats and the possibility of carrying rabies. We just need to not let children pick up a bat if they see it on the ground, to not be afraid. We need facts, not fear. We need habits that keep us safe. And this is things the One Health community can bring forward. And on the food and water safety front, our pollinators are struggling, from the bees and monarchs to the bats themselves, with all the diseases and the climate change, the issues, and the insecticides and pesticides in the environment. These are human inflicted impacts on our environment, and we've got to find ways to mitigate some of the negative impacts. My husband's an avid farmer here in North Carolina, and when he plants squash now, they will flower, but they won't set the buds, set the flowers, and develop fruit, because we think that we're really lacking some of the pollinators. So even in our local vicinities, we can start seeing this challenge. Some countries are having to hand pollinate crops. So I think that our food systems reckoning with nature is coming. We really have to come up with ways that we are going to feed almost 10 billion people before we reach the year 2050 without further destroying our environment and bringing terrible things upon us as a result of destroying those environments. We need to rethink our attitudes about where we as humans fit into the natural ecosystems and the kind of continuum. And sometimes even when we're really trying to help, like this is the flame retardants that we often spray when we have forest fires. We now are learning that some of those have like 10% ammonium phosphate in it. And in those environments where we're using it to control forest fires, it's contaminating the waterways and setting them up for harmful algal blooms and killing the fish. So, these are such circular thought processes that we have to pull out and examine in a One Health way to all the many, many different aspects and the different professions and different expertise and professionals that we need to bring to the table. I'm probably, I know that I'm pushing the time here, but I'm going to tell you another real quick story because I lived this one. And this little guy in the red shirt here was mine. So that was about 30 something years ago. He broke with a terrible, terrible diarrhea, and it went on for 6 weeks. And we had no clue what was going on. The pediatrician didn't seem to be trying to diagnose it, didn't seem overly concerned. And I was getting worried. My little baby was getting dehydrated. His little eyes were sinking back into his head. I was afraid he was going to have to be hospitalized. And my husband and I were both at the vet school in North Carolina at the time. And he finally, in frustration, because he and I both got sick. So this was obviously infectious. And we were so sick, we couldn't lift our heads off the pillows and trying to take care of a sick child. So he finally took a soiled diaper into the vet school. And if I were in a room where I could ask you what you thought it might be, I would always love to do that. But I'm going to have to fly here. So I'll just tell you, it turned out to be Cryptosporidia, which is a waterborne pathogen. And at that time, it really wasn't on the radar of the human health community because it was something coming out of the veterinary community. And it kind of got put on the map because of HIV/AIDS, and so many AIDS patients were dying from Cryptosporidia. So the bottom line here is because there are difficulties exchanging information across the different professions, especially 30 years ago, it wasn't on the radar for the human health practitioners. And so what if there had been an immunologically compromised person in our household? It could have been devastating. So this probably would be better these days, but it's just an example of how we really, really need to have those conversations and those forums, those mechanisms for us to exchange information coming out of the veterinary world into the human world and vice versa. So very quick story. And that, coming back full circle to zoonotic diseases, some of you remember back in 1999 when West Nile first came to the Western Hemisphere. And actually that was missed for several weeks. There was some confusion, and my colleague Tracy McNamara has done a great little YouTube story about how she was a veterinary pathologist at the Bronx Zoo at the time, and she contacted CDC and said, I'm not so sure this is St. Louis encephalitis, which is they thought what it was because there were people dying, and there were also crows falling out of the sky, and dead crows everywhere. And it turned out it was West Nile, and even our structures and our agencies were not tied together and working together and closely enough at that time. So if you've got time, go and watch this little YouTube. It is very startling. One of the things we point out, and I'm sure this is true in Europe and around the world, we put so much money into human health, some money into agricultural species, animal species of agricultural significance, almost nothing into surveillance of diseases coming out of wildlife. So, we really are, our funding structures are, the absolute opposite of One Health. So I urge you to go and enjoy that, because what we're ending up doing is using humans as our sentinels for things that what the animals are being exposed to could be telling us. So it's very frightening. And of course, now we're dealing with this horrendous pandemic. And I have to tell you, it's really embarrassing to be from the United States. This happens to be a schematic of the Johns Hopkins map that's been tracking COVID cases So back in April of 2021, about a year ago, we were the reddest continent on the country because we did not do a very good job, which is shocking to many people unless you know a little bit about how our public health systems work in the United States. So, we have really had a wake-up call. I know that our own listserv has popped up over 6,000 since the pandemic started, because so many people are going, oh, is this what you've been talking about for 15 or 20 years? So yes, and this is where, the land use and the spillover because of our increased closeness to animals. This is a whole, circular patterns of behavior and environment destruction and putting us closer to animals, and some of our behaviors, like, some of the animals that we like to sell in wet markets. We've really got to rethink some of those systems, or we're in really bad shape. And of course, now in the United States, I would love to hear what it's like in Europe, but now in the United States and Canada, we're seeing COVID now becoming endemic in the deer population. And of course, the deer, for the most part, are not getting sick, but the concern is the variants that could be developing in those populations and then jump back to people. So these are just critical and pretty terrifying whole situations. And, just to remind you, nature is not the enemy here.
Yeah.
It's us. Yes, I thank you. I will wind down now. So thank you very much for the opportunity.
Thank you so much, Cheryl. Yeah, and sorry for interrupting. I hope I didn't cut you. Yeah, super interesting what you could share in these 20-25 minutes with us already. The need to rethink our attitudes, to also change maybe funding structures, and also thanks a lot for sharing this personal story about how you actually came into contact with an example of where One Health wasn't applied and actually made some damage. So yes, I'd like to open the floor if there's any questions. Now we have we kept some time for questions for Cheryl. You may just raise your hand and then quickly say who you are. If there's no question right now, I'd have just one question for you. How, given your experience there in the last years with the One Health Commission, how do you see how well prepared or aware do you see the international community, let's say decision-making communities, expert communities? Did we need COVID-19 to have a shift in really rethinking our priorities, or is it still not happening? What is your take on this? Well, yeah.
Well, my next few slides was going to point out some of the exciting things that are going on in the international community. So yes, we've got this buy-in and understanding now in the quadripartite. And that's very exciting. In many countries, Switzerland among them, and Germany with its GIZ, and France with Preparedness, and the One Sustainable Health Forum. And we've actually just launched, one of the slides I was going to share is we've just launched a map of all the countries that have officially adopted national One Health strategic plans, which is also very exciting. And, we need to turn the US green on that map and Canada green on that map, because we don't have an official. So now this is where we get into the whole discussion about policy and what needs to happen on the policy front. So what we really need is a top-down, bottom-up effort here, a grassroots effort like you guys are able to provide, and also helping our lawmakers and policymakers understand this for helping our agencies, our federal agencies, really learn to work together across the agencies.
Thank you so much. I think there's a question by Utunugwa. Yeah, sorry.
Yeah, thank you. Thank you so much. Thank you, Cheryl, for the wonderful talk. I mean, I'm a student. I'm studying for a master's in One Health, and I just came across the concept a year or two ago, and it's been really insightful to hear from someone who has been studying One Health or practicing One Health for a long time. So I was just wondering how what do you think? How do you propose that young people are involved in embracing One Health approaches? Because I mean, I didn't know about the concept, even though I studied microbiology and I was in the biological field for a long time. But it doesn't seem to be something that is talked about in lower education. Generally, how do you think that could be changed? Is it necessary for that to be changed also?
Well, thank you for that question. I think students are just incredibly important in this whole One Health conversation. And if you've not connected yourself with the International Student One Health Alliance, or if you don't have a Student One Health group at your school, please consider starting one and getting involved, because I find students to be a huge driving force and powerful in what you can bring to this conversation. And I tell students all the time, I call One Health our ray of hope. And students are the force multipliers for that ray of hope, because students haven't yet really crawled into their silos. They're not intimidated to go talk to people in other professions. You students are, you really, truly, in really focusing and making that ray of hope much more intense. So those are just some of the ways you can get involved, but be sure, even as you're building your research projects for your master's and your PhD, or if you're in a professional program, be sure that your faculty at your medical school or your veterinary school understand and know about One Health. And one medical student I knew actually did a survey of the faculty and students at her medical school to see if they knew anything about One Health, and they didn't. So she went to work educating them about it and actually was able to put together her own One Health elective. So I just tell you, you students are very powerful and so important in what's going on in this conversation. Those of us who have been really active in this front for years are not going to be around forever. You guys are going to be the ones to carry this forward and to really probably get to live to see One Health be truly made the default way of doing business and thinking and acting in the future. So thank you for the question. You guys are incredibly important.
Thank you so much for this call to action. I think Ada, you had a question. Yes.
Hi, I'm a professor in the veterinary medicine. Originally, I am located in Turkey, but at the moment I am in Reno, Nevada. Previously, I was in Minnesota. Now, I'm quite interested with the One Health concept, because I also work in Ministry of Health and Ministry of Agriculture in Turkey. And we were collaborating with the University of Minnesota, and I have been in the organization of the ICOMOS and the establishment of the COMOS consortium. And Turkey had a big One Health program, multi-sectorial health responsibility program, it's called. But what I have seen since I started to do this today, how you will going to convince or make them to agree to collaborate to decision makers, especially in the politicians, because it is very important. I mean, it is not, the structure is not like the same in Europe or in US. In US, it is easy to, one university can collaborate every other, even the government institutes. Or in Europe, it is easy to control something inside the country. But since the diseases has no borders, I mean, Europe will never be safe unless your backyard will be clean. Like the countries like Turkey is very crucial. I mean, not because I am from Turkey that I am saying this, because originally Turkey is also the starting point for the middle of Asia. There is lots of Turkish-speaking countries in the old Russians, and also as a religious, Turkey has a lot of contact with the Arabic countries. So all these cultural interactions, also Turkey can be a key point to affect these countries too. But how are you going to convince the Turkish government, I mean, to collaborate with you? Because there are lots of things, and locally there is lots of differences. For example, you showed the example for the India, tuberculosis. I mean, there might be their local reasons that they cannot prevent the tuberculosis, but in Turkey, it is totally different. They cannot prevent it because it is politically they cannot prevent it. As a law, you have to report the tuberculosis, and if you report it, then you get the money back from the government. but
Thank
the
you.
government
Thank you.
doesn't want to pay the money,
Uh-huh.
so you cannot diagnose the tuberculosis. So locally the problems are different. So how are you going to convince the politicians and the decision makers that they can collaborate with one in the concept of the One Health, and then how you are going to keep your countries safe?
Thanks a lot, Ada, for this question. Almost a statement as well, I would say. But Cheryl, do you want to quickly answer this one? How to convince decision makers? And yeah,
very quickly, Arda, it's not as easy as you make it sound like in the US and Europe either. These are questions that we're all grappling with. And to me, it all comes down to education and awareness raising. This is the reason I say we need top down, bottom up, because think tank groups and local groups can make a lot of noise and bring a lot of pressure, if you will, to lawmakers to pay attention to this conversation. And I know right now I'm advising one of the senators here in the US because we really are trying to implement One Health here in the US that would really help our federal agencies work together. And I think Canada's starting to work on some similar things. So you are so right. These are incredibly difficult challenges. And all we can do is, as professionals, is keep raising our voice. We as scientists are normally really terrible at trying to reach out to the public and to lawmakers and make our voices heard. So we've got to get out of our comfort zones and take this message of this incredibly important conversation that really it could affect our future in drastic ways if we went into the climate change discussion, which is how that's affecting the zoonotic diseases discussion. So you are exactly right, Arda. These are very difficult, and all we can do, I did tell some of my colleagues, is all we can do is just keep swimming, just keep trying and doing all the things that we can do, and to try to take this message to our lawmakers. And everything that we've said today is kind of geared toward helping us do that, but it is not easy. So I know that there are some groups in Turkey. I've been following them. We actually have some of them on our who's who list. So just keep doing every little, do what you can with what you have where you are. That's the take-home message. We just have to keep trying.
Thanks a lot for this conclusion. No, so I'm sorry, Ada, we need to move on a bit with this part, but we make sure also to, in case you can keep on the discussion later on as well if you have follow-up questions. But yeah, let's keep on swimming. I think that's a good last concluding word for your part. And now I quickly want to introduce our second speaker, Wim Kim Nguyen, the co-director of the Global Health Center at the Granite Institute in Geneva. He's an HIV and emergency physician and medical anthropologist. And he is also really interested in the concept and literature of collapsology of health systems. And that's why we invited him to give us a little input about these theories, to bridge also to make the bridge from this more general discussion about One Health and why it really matters to our next part of the workshop, where we're looking at dystopian scenarios, future scenarios around the three phenomena we have been discussing since the beginning of the workshop. Yeah, Wim Kim, I'm giving you the floor. You have now the floor is yours. Thank you.
So good evening. Thanks for having me. It's very flattering, and thank you, Cheryl, for your presentation, and of course to the whole foraus team. I've been asked to speak about something a little bit different, but I wanted to just echo with a very quick anecdote what Cheryl has been telling us, which is that the phenomena of antimicrobial resistance is very complicated, but one of the things that we're learning is that I think one of the big takeaways from the science is that we are much more connected with our environment than we have previously thought through things like the microbiome. And we're actually, as some of you may have read, we're actually finding out that we've actually got all these micro plastic particles within us. And so really we are becoming, literally becoming what we're throwing out into the environment. Antimicrobial resistance is probably just the tip of the iceberg here, but it's a very worrisome one. And we really are facing the prospect of losing effective antibiotics in the horizon of 10 or 15 years, And that would really set back, I think some people don't realize this would set back medicine literally 100 years. It would bring us back to the era before cancer treatments, because we need antibiotics to manage the infectious complications of cancer treatments, of surgery, and so on and so forth. So that's kind of the dystopian entry point. And what I wanted to do is to talk a little bit about these kind of dystopian scenarios, and maybe with a ray of hope, which is manifested in these kinds of mobilizations that we're having tonight. So there's been for about since the mid 2000, so 2005, 2006, 2008. Since then, earlier in other circles, there's been the dawning realization that our current society, and this echoes Cheryl's point at the beginning of her presentation, is that our current sort of pace of consumption and environmental degradation is not sustainable. There's basically two, particularly in light of what we know about climate change and the climate emergency, there's two basic outcomes. Either we keep on going as we're going now, and we will arrive at catastrophic levels of average temperature increase in the next 10, 15, 20 years, which will lead to environmental changes that will not make feeding the planet possible. Or we cut carbon consumption to zero, which also will lead to the collapse of our societies. That we have become so dependent on these high levels of energy and of carbon extraction that if we stop, we'll collapse. Now, this is a view that has been adopted by I think initially a very fringe part of the environmental movement, but perhaps becoming more mainstream, particularly in the last few years as we started to see this layering on of climate disasters. But I think it's worth taking these scenarios of collapse quite seriously and asking whether, and this is an empirical question, whether they are actually fit the data. Now, some of you may have read Jared Diamond's book on collapse, and a number of other studies, including Joseph Tainter's famous study from the mid-1990s. And these are people who have studied in the past societies that have collapsed. And I think there's a bunch of take-home lessons from that, and that we need to take quite seriously. The first one is that these complex, so the argument goes that as societies become more complex, more top-heavy, more divorced from agriculture, and increasingly reliant on complex social systems, priests, bureaucrats, and so on, to keep the whole society going, which is kind of a classic anthropological or archaeological observation. They become increasingly dependent on high levels of energy extraction, and increasingly susceptible to, or brittle, if you will, to collapsing with significant environmental shocks. And what we see is that they revert to more simple forms of society with less division of labor, less social and economic specialization, a kind of a Durkheim in reverse, for those of you who are familiar with Durkheim's theses in sociology. But what these studies show is that this happens over a very, very long period of time. It happens in societies that are highly stratified, which you could argue ours are, with ruling classes or elites that are increasingly out of touch and think they can be insulated from whatever social stressors are occurring. But they happen over a very long period of time, over hundreds of years. The second, I think, important takeaway message is that none of these societies were as globally connected as ours. So Interestingly, we have two, perhaps, well, I think now 3 test cases of the kind of major societal stressors that have been global in scale. The first one was the global financial crisis of 2008, which was probably far worse than people realize. The second is the COVID pandemic, and the third now is the war in the Ukraine. So these are major polysystemic stressors, which led to all kinds of economic and supply chain disruptions. And we're going to see this with the Ukraine, but none of them seem to have brought about a form of collapse, which is perhaps encouraging and suggests, and we know that from networks, that there may be more resilience. There may be more magnification or amplification of stressors, but there may be more resilience in a globally networked society. So I think there's a cautious note of optimism there. The second one, which I think we saw very much with COVID, if we zoom out a bit, is that populations have an incredible, and humans in general, we tend to adapt very quickly. We change behavior very quickly in ways that are unpredictable and where small changes have very large cumulative effects. And I think that's also a note for optimism. It shows that if all of us do a little bit, then maybe like wearing masks or adopting a new technology like vaccination, it could make a difference. So I just wanted to sort of share that with you. We haven't much time, but I think there's both, I mean, when you look at what's happening with climate change, particularly, it's terrifying and really can be quite depressing and lead to demobilization or to feeling kind of powerless. But I think there's a silver lining in these clouds that are gathering, and that's why I think the work that we're doing tonight is so important. So I stop there so that there's time for discussion. And I would encourage you to think about how you and the communities you were in and the countries you live in adapted through COVID and the financial crisis, and will likely adapt through Ukraine, and look at what the positives are in that. Over.
Thank you so much, Wim Kim, for this little input about collapsology of health systems and still this way of hope. Maybe Cheryl, if you, I'd like to maybe do a little ping pong here, trying to see how do you see the One Health community reacting to these to major challenging scenarios that we have seen, like COVID-19, or also maybe Ukraine is a bit early to talk about the reactions, but how?
If I can say one thing about Ukraine, sure. And I think Cheryl will agree with me, one of the very worrisome kind of long-term fallouts, and that's a bit of an unfortunate word, of Ukraine is going to be antimicrobial resistance, because not only of leakage from all this destruction of antibiotics and treated sewage and all these people who have been horrifically wounded, lack of antibiotics, lack of appropriate surgery, etc. But another fact that many people don't know is that heavy metals drive resistance to antibiotics. And so the leakage of heavy metals into the environment and into bodies, either through shrapnel or just through environmental contamination, is likely going to fuel a huge AMR crisis.
Thank you for this comment. Yeah, and yeah, quite some worrisome comment about Ukraine and AMR. Cheryl, do you want to react about the question I had?
Sure. I am really heartened to see what is going on in the One Health conversation around the world. We really are maybe approaching a tipping point, but we have such a long way to go yet to really truly make One Health the default way of doing business for all the things that we've talked about. With helping lawmakers and policymakers understand it, which is why I say we just have to keep swimming. And you're right. I don't study collapsology like you do, but it's pretty terrifying when you think of the huge global stressors, and you can see the collapse of systems, because really what we're talking about here are systems challenges. these are systems challenges that, we need to approach in a systems way. And, certainly as a veterinarian, I was not taught to think that way. Kind of bends the brains of most veterinary practitioners if they talk about systems. I even had a colleague, I was giving a presentation once, and I made the claim, well, these are systems challenges, why we're having so much trouble. And his colleague came up to me afterwards and said, well, what do you mean systems challenges? And I said, well, it's our systems that we've got to rethink how to approach these things and to put laws in place that actually give our agencies statutory authority to get out of their lane and work together. That's one of the challenges that we're experiencing. And he said something like, well, you're not going to change the systems. And I'm going, why not? That's what's got to happen. So yes, it's a huge leap to start thinking in terms of systems beyond individuals.
And small changes can tip the system. It seems so big and complex, but journey of 1,000 miles starts with this as the first step. There's very small changes can be adopted by large amounts of people and affect systemic transformation.
Yes, thanks a lot for these almost, I would say, concluding words for this first part of the workshop. Thank you so much, Cheryl, for joining us from North Carolina. Highly appreciate it. And also thank you so much, Kim, for joining us from Geneva and just next door. We will now dive into the workshop part. And I'm going to share my slides again to explain you a bit more about the next steps. So we will challenge the systems a bit further in this next 1.5 hours. First of all, we will break out in 4 groups according to the 3 phenomena we